What does informed consent for trazodone look like? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're going to be talking about probably our most commonly used medication for sleep, which is trazodone. The brand name for trazodone is Deseril, but it's usually just prescribed as the generic now. So this is an antidepressant, and it's actually only FDA approved for use in depression. However, it's most commonly used off-label for insomnia. It can also be used off-label for things like anxiety or panic disorder. And so one of the key things to remember with this medication is that the effect is going to depend on the dosage. So when it's at low doses, like 25, 50, 100 milligrams, it's primarily being used as a sedative hypnotic. It's going to make you feel sleepy. It doesn't really get to the antidepressive effect until it's up to about 200 or 300 milligrams. And we don't often use it as an antidepressant because a lot of times at this dose, it's just too sedating that people aren't able to tolerate it. So it acts as a serotonin antagonist and reuptake inhibitor, which the simple version is that it increases serotonin and it modulates serotonin receptor activities to help regulate mood and sleep. Of course, it's a lot more complicated than that, but I'll leave it there. The smallest dosage is 50 milligrams. However, I will often recommend that a patient take half of a 50 milligram tablet and start at 25. In terms of side effects, it's going to have similar side effects to most of the antidepressants, but the things we counsel patients most about are going to be obviously drowsiness and sedation. It's going to do that and make you sleepy, but this can last even into the morning. And so I often have patients complaining of like a hangover effect where it's really hard to get up in the morning. So I do recommend giving yourself at least 8 to 10 hours from the time that you take it to the time that you need to wake up. It also is going to cause dry mouth and dry eye. Sometimes it can cause restless leg syndrome. There can be dizziness, fatigue, blurred vision, headache, nausea. We don't recommend taking it on an empty stomach. However, it's usually taken in the evening, so usually people don't have an empty stomach at that time. More serious side effects that we might look out for would be things like trouble urinating, liver injury, and priapism, which is when there is an uncontrolled and sustained erection for men, and this could actually be a medical emergency. Like other antidepressants, unless it's taken occasionally as needed, it's going to require a taper when you discontinue it because there is a risk of withdrawal symptoms. So I'd recommend a hyperbolic taper, just like with any other antidepressant. Of course, I would answer any questions they might have, and then we would go forward making a shared decision from there. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings or resources that I want to be able to communicate directly with you all about. So if that's you, then send me a DM with your email, and I'll see you in the next one.